You're man. Okay, we're on.
That was funny.
That was funny. That
Okay.
was, and this is not funny.
No,
Headaches, doggone it.
Headaches.
Yes.
Wow, I'm so excited about talking about this because it's such an important thought process that normally you wouldn't connect it with dentistry. So, do you know, so how many people in the United States suffer from headaches? Little headaches, big headaches. And when we talk about headaches, people say, oh, I don't have any headaches. And I go, well, what about those little tension headaches?
Yeah.
And they look at me and they go, well, doesn't everybody have those?
Yeah. No, a lot of people don't. But
A lot of people
I'm
do.
going to tell you, I know that the percentage is going to be a lot lower than what you and I think, because there are so many people that suffer from different types of headaches. I was a migraine sufferer, and believe me, there are times where you just wish you just were gone. You didn't want to have to deal with it.
That's right. So what would life be like without a headache? Okay, so there are there's 4 women for every 1 man that suffers from headaches.
Right.
So it's really prevalent, and it's usually from women about 20 to age about 50, 55. Okay. Then after that, it seems to taper off, and I think we've got some reasons why that happens.
Could it be hormonal after?
Hormonal and structurally too.
Oh, okay.
Could be. So how many million Americans suffer from headaches? 20 million, at least 20 million. That's about 7%. I think the number's a lot higher than that.
I would say it'd
okay?
be a lot higher.
Yeah, we just had a little poll right here, and
Yeah.
you know, and both women we talked to had headaches.
Virginia,
okay?
Virginia suffered from
Yeah.
migraines as well as I do.
And the man we talked to here, okay,
He had them.
He had headaches too.
Right, right.
So it's really prevalent. And dentistry can what we're going to talk about today is that that the head and neck have everything to do. It's all in your head. Okay,
Right.
one way or the other, it's
Right,
all in
it's
your head.
all in your head.
So we're going to talk about that. So do you know that the joints, the temporal, this is the temporal bone here, and this is the mandible, so we call this the temporal mandibular joint, or TMJ. Okay, and that joint is used more than any other joint in the body. Okay, so what we're going to talk about today is how the teeth and jaws can affect and cause headaches. And so the first principle is that, and we do at Jackson Creek Dental Group, all our doctors, we do a pretty intense screening on every single one of our new patients on this because it's so important. Do you know that over 50% of all visits to a physician are for head, neck, and back pain? Half. So there's a lot of money being spent, and the physician, they're great. They have to rule out all kinds of other things. Okay, they do you can do the MRI scan.
Right,
okay,
right.
and that's what $1,000, and then they can write prescriptions. Like Imitrex is one prescription that it seems to be has been popular in the past as far as headaches. But I want everybody to know that there are other options,
Right.
and to see.
So what you're saying is a lot of times the doctor should say, okay, before we start going into a medical,
Exactly.
Into medicine, you should go see your dentist.
Right. Now, the problem, and that happens sometimes. We get some referrals from physicians. We have not done our job well enough, and we're not, as dentistry as a whole, we're not together. Everybody has a different idea, and it's complicated. There's very complicated. In fact, I'm going to show you some pictures here.
Okay.
There's a lot of. There's a lot of blood vessels going right through this area right here.
Right.
Okay. There's a lot of nerves going right through this area here. Okay. And so it's about a third of all the nerves go right by this joint. Okay.
Right.
So it's complicated. And so everybody has a little idea, but there's universal agreement that for the most part, okay, that headaches are caused by muscles. Okay? And the physicians agree with that, neurologists agree with that, chiropractors agree with that, physical therapists agree with that, and dentists agree with that. So there's some agreement there that 90 to 95% of all types of headaches, little tension headaches, and there's some, even migraines, that more and more people are thinking that even migraines are caused by muscles. Okay? And so how are you treating the muscles? Okay? And it's like, if you have a little pebble in your shoe, okay, and you walk here from across the room, okay, that's not a big deal, okay? But if you have that little pebble in your shoe and you're walking a mile or you're doing a marathon,
after a while,
you're going to be favoring that side, and all the muscles on this other side is going to be all tweaked, and they're going to go into spasm, okay? And that's exactly what can happen, like what Cam talked about a few minutes ago, that he had that the bite wasn't quite right, and those muscles are overworked and can cause go into spasm and then refer
And when I had my migraines, it was because I sat at my desk and I'd have the phone like this.
There you go. And so your muscles were really tight
right in there.
Okay.
And to this day, when I feel one coming on, I can feel on this side
your muscles
my muscles are tightening up.
So
and,
there you go.
And your jaw clenches.
There you go.
Now, when you mentioned all of the veins and the capillaries and everything in here,
and
arteries, this is why when kids get hurt or they fall or whatever, you see a lot of blood and people go crazy. It's basically normal because the head, the face, the mouth bleeds heavy anyway.
Okay.
Is that true?
Sure.
Oh.
Thank you for bringing that up.
You're welcome.
Let's get back to headaches. Okay, I want to show you. I want to show you. Let's talk about a little anatomy so it makes sense. Okay.
Okay.
Can we see this? Okay. So basically, we've talked about this is the mandible. This is the temporal bone. This is the temporal mandibular joint. Okay. And I'm sorry. We need to get this a little bit more organized. Okay. So, okay, now these are the muscles, and these are pretty close to being with the muscles. So there's the temporalis muscle, there's head and neck muscles that hold the jaw. Now, understand that so then there's a little disc here. So now this joint rotates. Okay, rotates. This is what all the joints do is rotate. But this joint does something that no other joint does, and that is it slides. It slides.
So when that gets out of alignment, you've got problems.
Right. So if your teeth do not support, the joint, then when you bite down, it slides back. And that's where that click is. So it clicks onto the disc, and then it clicks off the disc.
I see.
And so so if you're hearing clicking and popping, it has to do with the teeth alignment. Now there's also a lot of blood vessels and nerves back here, so if it ends up going too far back, it can infringe upon that, and that can also cause pain. Okay, so what do we do about it? Let's talk about that. Okay, there's ways if we can bring the lower jaw forward, and reduce and increase the space here, we're going to get some healing. Okay, so some of the treatment is we make splints. Okay, we do some orthopedic appliances. This is a twin block appliances to bring the jaw forward. Okay. I teach a seminar on adding little lingual shelves back to the front and the back of the front teeth. We call those Levy lingual shelves.
Okay.
Dr. Levy is the one that showed me this 25 years ago at a seminar in Boston, and that actually helps open up the bite, so we can change the bite. Okay, and that just does it by just opening the bite up, but sometimes we have to actually bring the jaw forward, and that's what these appliances are for. Okay, and that's how, and we can affect that. So if you're having headaches, see the dentist that's trained in this. Okay, because not all the dentists have that interest in that, and there's only very few actually.
Great.
Okay.
Good. And I think she needs some earrings.
Yeah.
I really do.
Okay.
I really do.
So anyways, this is a really important subject. Get help from your dentist. Talk to your dentist about headaches. Ask your physician, hey, can my dentist help? And just it's significant.
Right on. And I'm going to run over to Cam.
Okay.
And at the end of the show, if there's anything that we have forgotten, please bring it up.
Okay.
Thank you.